let's jump into some segments. Now, Travis, do you remember when we talked last year about the plastic surgeon that got charged with murder in the care of a patient? It was it was back in April.
Sound kind of familiar.
Yeah. So today we're going to do an update on this story of the plastic surgeon charged with murder of a patient. And as I said, this is an update to a story we did back in April of 2023. And I brought just a little clip of that episode, Trey, a little video. You think you can roll that for me?
Of course.
There is now another plastic surgeon charged with murder, and this one, man, it's crazy. It's different than the last one, and I think that's what makes this story so shocking. He's charged with murder in how he was treating a patient. This is about a patient who died under their care, and what makes that unusual is you usually would never see, a doctor charged with like crime for that. You can get charged with malpractice, but that's usually a civil case, not a criminal case. And the doctor's name is Carlos Chacon. I think I got a picture of him, Travis. Throw that up there if you would. That's him. I was like, this is not good. It gets worse. I mean, it just goes from bad to worse to worse to worse and worse. Yeah, so that was back in April of 2023, and it was a pretty unbelievable story back then. And I'm just going to recap it for those who maybe not have heard about it. So it's a very tragic story. A girl named Megan Espinosa, 36-year-old, mother of two, died in 2018 during a breast augmentation surgery in San Diego. And of course, that's super unusual because in general, breast augmentation surgeries are, they're not super invasive. They're not like having, heart surgery or, working on your intestines where things can go really wrong. And so just the fact that she died during that surgery is just very unusual. And so the reason we're updating is because there's been some more information come out. And I think I have a picture of the people involved, just if people want to look it up. Yeah, so that's Megan Espinosa there on the left. She was unfortunately the victim. The nurse is Heather Vass, and then the surgeon, Dr. Chacon. And the reason I have all those people up there we'll get to. So what basically went down with this story is she was having a breast augmentation in an office OR, which is something I'll bring up in a little bit. And so Dr. Chacon, the guy, instructed the nurse, Vass, to give her some medications. And so, there was no anesthesiologist there. It was strictly a nurse giving her medications. And this is information we didn't have last time. So they gave her fentanyl, Percocet, and ketamine. And yeah, those are some hardcore drugs. I mean, obviously you can give people very low dose, but giving 3 really strong medications like that to somebody without proper monitoring or the proper safety of like having an anesthesiologist around is potentially very dangerous. And, one of the big things about this and why it went to the level of crime is that nurse is not qualified to give those medications. And that's one of the big problems in this. So in addition to that, and this is also new information, the doctor instructed another teammate who is unnamed to inject local anesthesia into the breast. Well, this person was not qualified to do that. So you got, 2 people doing medical procedures that really aren't qualified to do them. And apparently this was not the first time. That nurse, Heather Vass, had done this apparently 100 times where she was giving these really strong IV medications to patients, without the proper monitoring or proper support. And they had previous complications. Nobody had died, but now, that they dug into this, there was a lot of people saying, oh yeah, well, I went there and they gave me all these medications and then, I couldn't wake up for like several days.
Oh, wow.
Yeah, pretty crazy stuff. So what apparently reportedly happened is after they gave the medications and Dr. Chacon started the surgery, like Miss Espinosa turned blue, which, even I'm sure is like a non-medical person, Trey. I mean, if somebody turns blue, right,
Yeah.
like that's not good.
That's an immediate red flag.
Yeah, that's immediately something is going wrong here. And so, but what ended up happening, according to the people in the OR, is he kept operating. So this lady turns blue and nothing was really done about it. And then it just gets even worse. So during the procedure, he like leaves to go see patients, like to see consults. And one of the people in the OR apparently got really, concerned, and it's like, look, this lady's blue. Shouldn't we be like calling 911? And apparently, allegedly, the nurse said, no, we have to wait for the doctor. We have to wait for a doctor. Well, apparently 20 minutes goes by where this lady's blue on the table and the doctor's gone. And so he comes back and sees her, and instead of calling 911, this guy starts calling anesthesiologist friends on the phone. And he's like describing what's happening to this lady, and like, what do I do? And like the first guy is like, you need to call 911 like right now, which he doesn't do. He's calling around trying to figure out what to do. I mean, I guess he's like panicking. In the meantime, like a lot of time's gone by. The husband's calling in, and they're saying, oh, she's doing fine. Like there's no problems. So like a total of 3 hours go by from when she turned blue to when he finally calls 911. Allegedly, when he talked to 911, he downplayed what was happening. He didn't really tell him the truth. So long story short, they take her to the hospital, and she ends up dying, a little bit time later. And, we didn't have all that information when we were talking about it. And, I was talking about how unusual it is for a doctor to be charged with murder. Normally when patients have bad outcomes or even patient deaths, there's not enough negligence for there to be a crime. And so, it ends up being a civil case, right? It's a malpractice case. So they charged this guy with murder, and they charged the nurse as well. And what ended up happening, and this is why I hit the news, is they took a plea deal. So the doctor took a plea deal for manslaughter, was sentenced to 3 years in jail, and also loses his medical license permanently, which is, I think, appropriate. Of course. And then the nurse ended up taking a plea deal. She got charged with involuntary manslaughter, and she got 2 years in jail. And then the crazy thing about that is they didn't permanently rescind her license, which I don't know. I mean, that's a lot of people are upset about that, and I think correctly so. To do that 100 times when you're not really qualified to do that, it does show that this nurse didn't have patient's best interest in heart.
Yeah, for sure. And you said they had this issue like previously, like well, not the same issue, but they've had other issues in the past. Yeah,
they did. And of course, once something really bad happens and they start digging in, then a lot of other things come to light. Where they had given these patients these really powerful medications and they couldn't wake them up. And there was one patient that they just couldn't wake them up, and they weren't like dying, but it's not normal if the patient won't wake up from surgery, and they end up putting them in the car with the family, and the family's like kind of freaking out about it, and they're like, no, it's fine, just let her sleep it off. And of course, I think that patient ended up being okay, but at that, it's not right. If people are, if they're not awake enough to protect their airway, like if they get sick and throw up, I mean, they can die.
Of course.
And so, they got lucky a lot of times.
So with something like that, like is there, I know normally like the board investigates those issues, I guess. Do they have like the option to suspend a license? Or
and we talked about that last time is that, they at the time that we did our segment in April, they hadn't suspended this guy's license, which I was really shocked about because even we didn't have near as much information last April when we talked about this as we do now, but there was still a lot of really bad information. And I was actually mentioned in the episode last year, I was like, man, I can't believe they're letting this guy still practice.
Facts.
Well, then what ended up happening, Trey, is, as they got into the investigation and learned more and more, they did suspend his license prior to the trial.
Okay, right on.
I've said in the past that sometimes the medical board's slow to do things, that, people have these bad outcomes and the board, I get it. Like, medicine's like anything. It's not 100%. And sometimes even under the ideal circumstances, people have bad outcomes. So,
of course.
You can't run around and suspend everyone's license because something bad happens. But this is not that. I mean, this is gross negligence. It's completely different.
No.
But yeah, it's I think when we talk about these things, Trey, and I mention this all the time, it's like we're not talking about this to sensationalize it. At the end of the day, a lady died, and her family is had a tragic loss, and so the one thing that I think
that possibly could be benefited is to talk about, how do you prevent something like this,
Right.
or how you as a patient can avoid something like this. And there were two things about this case that are potential. I mean, they're potential red flags. This guy was a legitimate plastic surgeon. He did, do a proper training program, and that's something I talk about all the time because there are a lot of people doing plastic surgery that are not properly trained, and it's a big problem. But this guy actually did the proper training. But the one thing he didn't do is he didn't get board certified. Board certification basically means that after your training, you submit a bunch of cases to the Board of Plastic Surgery and say, okay, I'm a plastic surgeon now. I want to get certified that I am, safe and you guys approve of me. And so you have to take a written test, which is, quite difficult. And then you submit cases and you go and you do an oral exam. And it's really hard. I mean, a lot of people fail. In fact, I had to take my written boards twice because I kind of blew it off the first time, and I didn't pass the first time.
Oh wow.
And so, of course, I got mine all done. But it's really the point is it's really rigorous. Like, it's not an easy thing to do, and for some reason this guy ended up not doing it, which I mean, who knows why? But it at least is something that if I was a patient and I went to a doctor that could be board certified and they weren't, I might be like, hey, or personally, I probably would just skip that doctor, me personally, just knowing what I know. But the fact that he wasn't board certified is a little bit of a red flag. Yeah. And then the other thing too, and I've mentioned this in a lot of different segments, when it comes to safety, an office OR is never as safe as like a surgery center. I do my surgeries in a surgery center, which means, it's not a hospital, it's like a dedicated outpatient surgery center. And when you go to a place like that, it's really a big process, one, to get privileges. They look and make sure that you aren't actually the doctor you say you are. So, if you're like I said, non-plastic surgeons doing plastic surgery, if you're like a general surgery or an OBGYN that wants to do breast augmentations, the surgery center is not going to let you do that.
Sure.
They're going to check your schooling. They're going to check and make sure that you're board certified or you can't work there. And the other thing is that these surgery centers have a lot of oversight. So in this case, for example, if this guy was doing this in a surgery center, one, there'd be an anesthesiologist because they would never let that type of anesthesia happen. They would just be like, no, this is dangerous.
Yeah.
Yet you can get away with that in an office OR because there's no oversight. And then at the point that she turned blue and this guy's like, no, we're not going to call 911, we're not going to call 911, like that would never fly.
Yeah.
And so if this patient had been in a surgery center, she very well may have lived. Well, not very well, she would have lived because they wouldn't have let her get that type of drug push. The person giving the anesthesia would have been an anesthesiologist, not someone that's unqualified. And flat out, this patient would not have died if she had not been in office OR. And, I always hesitate to say stuff like that because I know plastic surgeons that are friends of mine that have office ORs, and they're good surgeons, and they don't do stuff like that. And there's lots of people out there that are good surgeons doing safe things in an office OR, but you as a patient don't know who's who. And when a surgeon's working in an office OR, there's not that oversight. There's no one to check to make sure that they're properly qualified, they're properly certified. There's no one looking over their shoulder to make sure that they're not doing the wrong thing.
Right.
And so it just adds that just layer of possibility for things to go wrong in that situation, whereas in a surgery center it wouldn't.
No.
So
For sure.
So I think there's a couple things to learn from this. It's a tragic story. Our heart goes out to the family, and at least it seems like justice was served in this case with those two people being charged and convicted, or taking a deal. So.